Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us again.
Well, thank you very much for having me on the program.
Yes, sir. Get straight into it. What are our current numbers, vaccination numbers?
Well, today we have approximately 228,337 persons who would have received their first dose of the vaccine. This would be about 46.9% of our adult population. And for second dose, we have 99,764 persons who would have received their second dose of the vaccine. That is approximately 20.5% of our adult population.
Okay. All right. I know that last week Region 1 was in the lead. Have we seen any particular increases in the other regions?
Well, regionally, for first dose vaccines, Region 1 is still in the lead. So for Region 1, they have 57.7% of their population would have received the first dose vaccine. Region 2 is at 43%. Region 3 is at 46.4%. Region 4 at 48.5%. Region 5 at 49.7%. Region 6 at 54.7%. Region 7 at 45.8%. Region 8 at 31.1%. Region 9 at 45.4%. And Region 10 at 14.2%. So these are for first dose vaccination.
Okay.
So we still have a long way to go because on average this is just 46.9% of our adult population. So we have quite a lot of work more to do to get people to take their vaccines. We have approximately 100 sites on a daily basis that is operating, but we have seen a decline in some areas where people are not coming forward. It might be because of a multitude of factors, including the current flooding and so that is going on in some of the regions.
All right. I noticed that there is another site set up at Kingston.
We have a site at Kingston to do testing.
Okay, testing.
You would know that we had a testing site in the Penitence, but I'm told there that we have some challenges with the conditions at the Penitence site, so we have moved that to Kingston. We're trying to find a kind of central location in Georgetown that is going to be easily accessible to people. So we are trying out the Yana in Kingston to see whether or not this might be a good site to do some testing. And we are still looking around for other suitable sites in Georgetown where we can offer testing.
All right, because you still have to consider the rainy weather and flooding and so on. As we're talking about flooding, we know that prior to the rains and stuff, the ministry had started its malaria campaign, and I'm sure that would have contributed in alleviating malaria and dengue and stuff like that. It would have helped the campaign. Could you talk to us a little bit about that campaign and just an update on flooding generally in terms of the health teams, what they're doing?
So in terms of malaria, as you rightly said, we started out by making sure that we had insecticide-impregnated bed nets that were available to people. As you know, these bed nets are very effective in reducing the mosquito population. And if you stay under a bed net during the night, then your chances of being bitten by a mosquito is severely reduced. These bed nets, because of the insecticide on the net itself, when a mosquito or any insect for that matter light on the net, they would come in contact with the insecticide and they would die. These nets generally last for about 3 years. And so we thought that this is going to be a very effective way of reducing the mosquito population in those regions where we have seen a lot of mosquito-borne diseases. So we had launched a program in Region 1, and we have distributed a lot of nets in Region 1. We continue that in Region 9, 7, and 8. So hopefully we wouldn't see as much mosquito-borne diseases even during these flooded times. So I think that's very important. So far we haven't had we haven't seen many cases of mosquito-borne diseases, although in some areas we have noticed, like in the Upper Mazaruni area, we have noticed an unusual increase in some of those diseases, and we made sure that those communities receive insecticide impregnated bed nets. In terms of flooding, we have been monitoring flooding. We have had teams that are in every region looking at this. So far in Region 1, we haven't had any unusual reports. Region 2, we have been monitoring the Pomeroon area where the flooding was more severe. And we did some prophylactic kind of work by distributing bleach and ORS to the communities in the Pomeroon. And I think that has helped because we haven't seen any cases of acute diarrheal diseases. In Region 3, we monitored some of the areas in 3 that was affected, and again we did similar work, especially in the canal area. So far we haven't had any flood-related diseases. In Region 5, the creeks, we have sent in teams to both Mahaika, Maikoni, and Abari. So we have sent teams into all 3 of these creeks. They did outreaches, they met with people, they offer medication. What we have seen in those communities is a lot of people get rashes, and we have been able to successfully treat them and leave medication with them. In Region 6, in some of those communities, like in Blackbush Polder, I think now the water has receded, and because of that, we had 3 cases of dengue in Blackbush Polder. Those patients are stable, and we have distributed bed nets, bleach, and a number of other things to make sure that we can do the preventative kind of work. In Region 7, similarly, we have done a lot of work in the Upper Maas, Middle Maas, in and around Bartica. We have outreach teams that went out to these communities. And again, did similar things to try to prevent mosquito-borne diseases, waterborne diseases, and I think so far we haven't had many cases. 8, similarly, we had teams that went out, and in Region 9, of course, we had teams that went out. 10, in and around Linden, there were communities that we have monitored and again provided relief to those communities, and we also have teams that have been constantly working in and around the Kukwani area. So I think the health teams are pretty much active in all the flooded communities and have been offering relief to those persons who need assistance. In addition to that, the ministry has prepared special kits. So when you receive a hamper from the CDC, you're also getting a small kit, medical kit, that would have some basic medication, oral rehydration salts, and so forth, that you can use to assist you during the period of the flooding.
Okay, thank you so much, sir. I wanted to go back to COVID just a bit. Any update on the hotspots, those areas that are still considered hotspots?
Currently we have about 1,541 active cases. Of these cases, we have 85 persons who are in our hospital, and of this 85 persons, 21 of them are in the ICU. We have noticed over the last week or two that we have had increases in cases in Region 9. So currently we have 316 cases in Region 9, and we have seen increases in Sand Creek, St. Ignatius, Lethem, Mokomoko. These are places that we have seen increases. Right now in Sand Creek we have 45 cases, active cases. In St. Ignatius we have 47. In and around Lethem we have 35, and Mokomoko we have 25 cases. So Region 9, there are places in Region 9 where we have seen this increase in cases, and we continue to monitor. And our teams, of course, are going to those communities and working with those communities. In Region 10, we continue to see cases in Amelia's Ward area and in Wisma. In Amelia's Ward, we have 42 cases. In Wisma, we have 40. And in Region 10 as a whole, we are monitoring 142 active cases in Region 10. We have also seen in Region 6 an increase in cases in and around New Amsterdam. We currently have 43 cases in New Amsterdam. And in Region 4, we have a constant set of cases in the Diamond Grove area. As of today, we have 37 cases in Grove, and we have 31 cases in Diamond. So these areas can be considered to be hotspots in a sense, but we have seen cases in every region of the country, and we continue to monitor these cases, do contact tracing and so forth. And if people really get sick, then we hospitalize them and provide care to them.
All right. Based on the reports from the teams on the ground, would you say that the cases, for example, in Region 9 are more imported cases, or persons aren't adhering to the guidelines as opposed to those closer to the city, like in Region 4?
Well, what I know in Region 9, a lot of those two shows have had restrictions imposed on their villages, so that they're not allowing a lot of people to enter their villages. So, but villagers tend to move from one area to another, and if they go to an area and they get infected, they probably will bring back the infection to their villages. So it's, I would say transmission. That's how probably transmission is occurring, because if you are not taking the relevant measures, then you will have challenges with transmission. Nevertheless, we do have these spikes in cases, and we have to monitor them very carefully to make sure that we reduce those cases and it doesn't continue spreading. So we have our teams are in some of these areas working on the cases, working with the community leaders and making sure that people are properly isolated.
Right. I noted too that the police had been clamping down. Are we seeing a steady flow of that clamping down on activities throughout the city?
Well, through Operation COVID Curb, the police and the army have been out working, looking at the bars, making sure that people are complying. And we have found a number of persons who are very errant. We have people who still want to have parties and all kinds of things that would put yourself at risk, but nevertheless you're doing it. So we're working. We would like to appeal to the good sense of people, because you don't know who you are inviting to these things or who invite themselves to it. And these events can quickly turn out to be super spreading events where someone who is sick there can pass the virus on to others. So we keep working on that.
Yes, sir. All right, my last question comes from a news source. They're basically saying several Caribbean Airlines staffers have been flying into Ghana to get vaccinated, and they're asking if there's some sort of arrangement with the airline, and were other Trinidadians accommodated?
We did receive a letter from the airlines to ask us whether or not we can assist with vaccination of their staff, and we agreed. So we have been working when the staff come into one of our vaccination sites, we'll provide the vaccines for them. We have basically a very open policy, so we don't check to see which nationality you are before you can get a vaccine, and so our policy has been very open, and I think a number of Caribbean nationals who are here in Ghana would have benefited from the vaccination program. For us to achieve herd immunity, it means that the people who are here should get vaccinated, and so if they're residing in Guyana, then we don't have a problem giving them the vaccine. We have also been working very closely with the airport, and we had teams that went up to the airport to do vaccination, and quite a number of the persons who are working at the airport have received their vaccines. We haven't covered all the staff, and so I expect that in the near future we'll be going back to ensure that those who did not take their vaccine, to see if they are now ready to take their vaccine. But because they are at the front line, it would be highly recommended for them to get their vaccines. So we'll continue to work with them.
All right, Minister, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.